Let's discuss the anatomical positions and anatomical planes, which are very much important to know and to know their concepts. So we have an anatomical position which is called as anterior, posterior, superior, inferior, cranial, caudal, right? So what do you mean by anterior, posterior? Anterior means which is in with the surface which is on the front, right? That is called as anterior. And the posterior means that is on the back. Let's suppose if you could see on your screen, this is the anterior part and this is the posterior part. So the anterior is the one which is to the front, facing the front, and posterior is the one which is to the back. I'm going to show it to you again. This is the anterior surface. So this is the posterior surface. Okay, so these are the posterior surface of the leg, anterior surface of the leg, anterior surface of the abdomen, anterior surface of the chest. Then you have the back, which is called as the posterior surface. Then you have the cranial and the caudal part, or the superior and inferior surfaces. So cranial means the skull and the upper part of the body. So when you're dealing with the one at the top would be superior and the one at the bottom would be inferior. So the head is at the top, so that would be cranial, that would be superior. And the feet, they are at the caudal end, or they are inferior to the cranium. But you always define superior, inferior to some reference point. Let's suppose when I'm talking about head, right? So head is superior and arms are inferior. But when I'm talking about leg, so the leg is inferior and the arm is superior. Arm was inferior when I was taking head as a reference point, or I was trying to discuss the difference between superior and inferior head and the arm. So the head would be superior to arms and arms would be inferior to head. But arms would be superior to legs and legs would be inferior to arms. So that is called as superior, inferior. You always take it as some reference point. So same thing with the cranial and the caudal. So the arms are cranial to the legs and this legs are their caudal to the arms. So that's exactly the same thing. The cranial, caudal, and superior, inferior, they are the same things, two different terms which can be used accordingly. Okay, so now we have another anatomical position which is called as medial and a lateral part. So medial means that is close to the body. Let's suppose we have a central point. This is the central part, and this is any part which is close to the body would be medial, and any part which is away from the body, that would be lateral. Okay, let's suppose I'm talking about sternum. So the sternum is medial, okay? I'm talking about the, let's suppose there is a laceration and I have to explain that laceration. So it's close to the sternum, it's close to the midline, so that would be medial. But if it's away from the body, it's away from the midline, that would be lateral. So that means medial is towards the body, lateral is away from the body. Then you have proximal and distal. Distal is away from the center point, and proximal is close to the center point. Let's suppose you're talking about the shoulder joint. So the shoulder is proximal and a hand is distal. But when you talk about the lower limb, the foot would be distal and the thigh would be proximal. So which is more close to the center of the body, so that would be proximal, and which is away from the center of the body, that would be distal. Like hands are distal, arm is proximal, forearm is distal to the shoulder. So you always have to define these terms to some reference, or you have to draw a comparison between them, right? So this is proximal, this is distal, this is proximal, this is distal. Distal is away from the body, proximal is close to the body.